Well, when Tyler was 2, and he's the middle of 3 children, he potty trained himself, which was fabulous. And by 3.5, he started having accidents again after a 1.5 years of being fabulous. He was in school, and the school was not happy about it. I didn't really love the situation either, but and as time went on, it was becoming more and more frequent. And he was only 3.5, and he'd say he didn't know why it was happening. We were battling some other issues as well. The school thought he might have ADHD, so there was things saying, well, maybe he's just, too unfocused and he just forgets he has to go to the bathroom or whatever. So it was a really tough time for a couple of years.
I thought Tyler, as all kids do, did a good job of acting like everything is just fine. But it's not normal for a child to complain frequently of back pain, pain in his legs. It's not normal for them to want to come in and lie down when all the kids are out playing. And then the urinary accidents, that story was very unusual.
And then when he got around 5, so now we'd been dealing with this maybe a 1.5 years, he started losing his bowel capacity. And then the school really had a problem with it. So he had an MRI, and that doctor recommended that it be read by a neurosurgeon. So knowing of Dr. Gilmer through my son's school, I called her. She calls me back and says, I think he has a tethered spinal cord.
If a child has a tethered cord and the child is still growing, the spinal canal is elongating, stretching out, and the spinal cord is stuck in one spot. So instead of growing up with the child, the spinal cord gets stretched, and that causes nerve damage.
I had never heard of a tethered spinal cord before Tyler. And once I started talking to people, Dr. Gilmer said, I think she does over 200 a year.
Tethered cord is underappreciated and underdiagnosed, and you don't know what the outcome is going to be. If a tethered cord is not addressed, someone may progress to the point of incontinence and paralysis. In Tyler's case, potentially he would have been incontinent for life. He probably would have developed scoliosis, back pain, and problems with walking.
When he got the accurate diagnosis, I sat down on the couch with him and just cried and apologized to him for the many times that I may have punished him.
It wasn't behavioral, it wasn't something he was trying to do at all. From a mom's standpoint, you do know when something's wrong.
I would say to get a lot of opinions and to go with your gut. I used to think that just because someone had an MD after their name, they had to be wonderful, and that's absolutely not the case. So you need to know that you're going to someone that specializes in that area, that does a lot of it, knows what they're doing, and is skilled at it. And the doctors at Michigan Head and Spine Institute, I felt were.
Well, I was scared at first because it was my first major surgery. I had never had one before, so I was scared of what would happen.
So he had his surgery, and it went off amazingly. He was in and out of the hospital within about 5 days.
Tyler did really well. He was a good patient, as kids always are. They're really very straightforward. They understand they have a problem, it has to be fixed. They get up and they just go. And actually, post-operatively, you find out that they weren't really so fine. They have much more energy, they're running around, their balance is better, and of course his bowel and bladder function improved to normal within a few months.
He's all better.